Good morning, everyone. Welcome to this new diabetic education session. Today we are going to discuss about type 2 diabetic mellitus in newly diagnosed adults. How are you all feeling today? I know being diagnosed with the type 2 diabetes can cause overwhelming stress, anger, and anxiety, but your feelings will be eased at the end of the session because you will be able to understand more about diabetes and able to manage and cope in your day-to-day life. So you can ask many questions as you like. You can stop me at any time during the session to ask questions. So let's get started. So the objectives for today's session is understand the pathophysiology and etiology of diabetes, understand the glucose metabolism in healthier people and adults with the type 2 diabetes, and able to self-manage type 2 diabetes and understand the applications of theoretical and practical issues and concepts. So what is diabetes? Diabetes is a disease when the blood glucose levels or blood sugar levels higher than normal. Normal blood sugar levels are between 4 to 5.4 millimole when fasting and up to 7.8 millimole 2 hours post eating. Now look at the pathophysiology of glucose metabolism in healthy individuals. So in healthy individuals, glucagon and insulin work together to maintain normal plasma glucose levels. There are key organs involved in this process. The first one is the intestine. So when we eat food, the food get digested in the intestine and all the nutrients as glucose move into the blood. The next one is the pancreas. So pancreas produces the hormone called insulin in the beta cells and the alpha cells produce glucagon. Next one is the liver. The liver stores the glucose in the form of glycogen and also it produces glucose from the things like amino acids, fats and proteins, and this process is called gluconeogenesis. The next one is the muscles. So all the glucose get absorbed in the muscle cells and it can be used when needed. Now look at an example. Let's say when we eat a bowl of pasta, it has got a lots of carbohydrates and the carbohydrates will break down into glucose. So during this time we have increased amount of glucose in the blood which is called hyperglycemia. So the pancreatic beta cells will sense this and release the hormone called insulin, and the insulin will help the glucose to move into the cells. Insulin also stimulates the process called glycogenesis, which means the liver will store the excess amount of glucose remaining. So then the blood sugar will return to normal. Now look into the opposite, the hypoglycemia, which means low level of blood glucose in the blood. So during this time, the brain senses the glucose is low and trigger the hunger response. So more food will eat and absorb into the intestine and glucose released into the blood. But also the pancreas sense the low glucose and produce the glucagon, and it target the liver and muscles and convert glycogen into glucose. It also tells the liver to produce new glucose, which is the process called gluconeogenesis. This is when the glucose is made from amino acids, fats and proteins, and then the blood glucose will return to normal. Now look at the picture here. So we have increased glucose levels, which is called hyperglycemia. So during this time, the pancreatic beta cells will release insulin, and then the insulin stimulates the glucose and the glucose move into the cells. And also it stimulates the liver, and the liver stores the extra glucose in the form of glycogen, and then the plasma glucose will return to normal. During decreased level of glucose, which means the hypoglycemia, the pancreatic alpha cells will release the glucagon, and also it senses the liver, and the liver will convert the glycogen into glucose, and also the liver produces a new glucose from the things from amino acids, fats and proteins, and move the glucose into the plasma, into the blood, and then the blood glucose will return to normal. Now let us look at the pathophysiology of type 2 diabetes. There are two combination factors are happening in type 2. First one is inadequate insulin secretion by pancreatic cells. So beta cell doesn't produce enough insulin, so the glucose cannot move into the cells. Or the cells do not respond effectively to insulin, so the cells become insulin resistance. Type 2 diabetes develops over a long period of time, so it's mainly diagnosed in adults. Now just look at the picture here. So we have a normal individual with the insulin and glucose. So when we have extra glucose in the blood, the insulin will be produced, and the insulin receptors, which is like an open channel for glucose to move into the cells. Whereas in type 2 diabetes, so we have increased amount of glucose and we got insulin, but the insulin receptor will be less sensitive to insulin production. So the glucose cannot move into the cells. So we have increased amount of glucose in the blood. During this period of time, the insulin resistance starts. This is where the insulin is increasingly ineffective at managing the blood glucose levels. As a result of the insulin resistance, the pancreas produces more and more insulin, and eventually the beta cells of the pancreas get destroyed. Now we look into the etiology of type 2 diabetes. So overweight and obesity, diet and lifestyle factors. So food that contains carbohydrates will raise blood sugar levels, but in the right amounts, they can keep the blood sugar within normal limit. Family history is a major risk factor for type 2 diabetes. According to the study in 2014, 56 to 71% of people those who are diagnosed with diabetes has got a family history. High blood pressure and also low level of good cholesterol and a high level of triglycerides also are risk factor for type 2 diabetes. So lack of exercise is an etiology of type 2 diabetes. So exercises will improve the insulin resistance and it helps the cells to use glucose more effectively and it prevents long-term complications as well. So other risk factors are smoking. The nicotine lessens the effectiveness of insulin. So it causes insulin resistance and it compensates the insulin production. Asians are at risk compared to white population. People over the age of 45 years old and a history of gestational diabetes. So the pregnant woman who was diagnosed with the type 2 diabetes during their pregnancy also are at risk of developing type 2 diabetes. Now we can look at the complications. So the type 2 diabetes can narrows or blocks the blood vessels that carry oxygen and blood supply to different part of our body. So this can cause heart diseases, peripheral vascular disease, which means decreased blood supply to the hands and legs. Cerebrovascular diseases cause decreased blood supply to the brain, which, for example, people can develop stroke, and kidney diseases as well. People also develop depression because the psychological effect from poor control of diabetes. So another complication is diabetic retinopathy, which means it affects the blood vessels in the eyes. So it can cause vision loss and blindness. Now we look into the management of type 2 diabetes. So we use a person-centered approach. So we want you to involve in the decision-making plan. We want to know if you got any disabilities, how are you managing your diabetes so far, what is your tolerability, what is your preference. So we want to have all this information before we take a decision plan, and we want you to involve and make a decision according to your choice. We also want you to involve in a diabetes prevention program. This program proved that the lifestyle intervention that includes calorie restriction and exercise to achieve weight loss, and it reduces the risk associated with type 2 diabetes. Healthy dietary patterns also an important factor for managing type 2 diabetes. So we will refer you to the dietitian, and the dietitian can support you to make a diet plan according to your choices. It's good to avoid food that rich in carbohydrates and sugars and include more of whole grains, vegetables, nuts, fruits, etc. And also avoid excess alcohol intake and avoid red processed meats as well. It is good to monitor your blood sugar regularly as well. This will help you to understand how activity, food, stress, travel, and illness influence your blood glucose levels. It also help you to understand when to seek help from the health professionals. Since we have the family members are present here, I will go through why the family support is important in managing type 2 diabetes. So family can assist people in promoting effective diabetes self-care management, and it can improve diabetes knowledge. Family can provide psychological and emotional support to the person suffering from diabetes. Family support helps them understand the disease and practice good self-management as well. In conclusion, most people know what they should do to improve their health, but it can be challenging. You can manage your diabetes by taking care of yourself on a daily basis. This will help to lower the likelihood of health issues. Talk to your healthcare team about setting up some goals to manage your diabetes to improve your health, motivation, and long-term health outcomes. Has anyone got any questions? Just let you know that managing your diabetes, you are not alone. We are always there to support you. If you are feeling down, if you have any questions, please come and talk to us or call us anytime. We are happy to help you. Thank you for joining in today. You have a wonderful afternoon.